The state's handling of nursing homes early in the pandemic remains a major debate. News Channel 34's Karina Capabianca has more on what some say can be done moving forward to increase protection, especially in the event of a second wave.
One issue that's been brought up is the state order in March requiring nursing homes to readmit COVID-positive patients. It was changed in May, but the governor was asked if he regrets that order today.
I understand what the Republicans say on the issue. It's not a coincidence that this is primarily an argument put forth by Republicans.
The governor has maintained the state was following CDC guidance. Assembly Minority Leader Will Barkley says it's not just a Republican issue.
I don't know how you can call it a Republican issue. Obviously, we're concerned. New York had about 6,000 nursing home deaths out of a population of 100,000. Other states like California and Florida, which never implemented that, have much lower fatality rates. California had that order in place and realized how crazy it was and pulled it back.
Nursing home advocates say to be prepared in the event of a second wave or resurgence, having enough PPE and testing is crucial, and that the old directive was implemented at a time when there was a fear that hospitals could be overrun by COVID patients and need more bed space.
I think moving forward, there's a recognition now that understanding the virus as we understanding it, going back to the potential for people to be infected and not present symptoms, and that really understanding that the men and women we care for are the most vulnerable, and we need to take every precaution that's reasonable to safeguard their health and well-being. I think in the future that type of directive would not be implemented and put in place.
Barkley says he'd like to see legislative hearings on the issue. In Albany, Karina Capabianca,